Good afternoon and thank you for joining us. My name is Christopher Horskamp from the Education Department of the EADV. Today we will be discussing healthcare services during the COVID-19 pandemic. A focus of this webcast is how to run a successful dermatologic practice in a pandemic situation. Now, we are joined today with Dr. Mihaela Leventer. She is a board certified in dermatology and venereology, specialist and trainer in Mohs micrographic surgery and cosmetic dermatology. She is currently the medical director of the Dr. Leventer Center in Bucharest, Romania. Also joining us today, we have Professor Leonardo Marini. He is a dermatosurgeon specialized in dermatology and general surgery. He is currently the medical and scientific director of the Skin Doctor Center, and he is located in Trieste, Italy. Again, we thank you for joining us, and I will hand it off to Dr. Leventer.
Thank you. And first of all, I'd like to thank the EADV and the European Board of Dermatovenerology for inviting me to present how to run a successful dermatologic private practice in a pandemic situation. And I have no commercial interest in this presentation. My presentation will cover global context, pandemic and dermatovenerology, new reality, and how I maintain the activity in lockdown, how to remain successful in time of crisis, and in conclusion, what help we need from our dermatologic organizations. Across Europe, the COVID-19 virus has caused many deaths, placing a burden on societies and health systems and harmed the economy. In January 5th, WHO published this data. 1 year of pandemic produced over 84 million confirmed cases and over 1.8 million confirmed deaths around 222 countries. The common strategy in European country members to prevent to another wave was to reduce transmission and closing non-essential businesses and closing places where people could meet and started resources for prevention with vaccine and efficient treatments. This snapshot across 163 countries published by WHO in June 30, 2020 explain rapid assessment of medical service delivery for non-communicable diseases during the COVID-19 pandemic. According to WHO, 71% of all deaths are due to non-communicable diseases. Since the COVID-19 outbreak, people living with NCDs are more vulnerable to becoming severely ill or dying from COVID-19. People living with NCDs are no longer receiving appropriate treatment or access to medicine during the COVID pandemic. When the community transmission started, 56% of countries disrupted services to treat cancer and chronic diseases. 75% of countries reported disruptions because of the high volume of cancellation of elective care due to transport lockdowns, closure of outpatient services, insufficient staff, insufficient hospital beds, unavailability of essential medicine, medical diagnostic and health products. For example, in the Netherlands, the number of people newly diagnosed with cancer dropped by 25% as a result of lockdown. Countries are asking for urgent guidance and support from WHO, like guidance how to provide continuity for NCD programs and communication materials about risk factors of campaigns targeting healthcare workers, and better data about the impact of COVID-19 pandemic on NCDs, and of course country support like provide training for policymakers and provide technical assistance. WHO concluded in June 30, 2020 that the world is at a critical juncture and is required to build back better tomorrow, which include the prevention, early diagnosis, screening and treatment of NCDs by implementing WHO guidance and develop digital healthcare solution for this pathology. 2020 was a difficult year for everybody, with many restrictions. The vaccination began in December 27 in my country, and it is continuing. There are more than 65 million doses of vaccine given at population around the world, but it is not enough. Some controversial, evasive decisions transform medical staff in an enemy. The fake news flourished, and so have the anti-vaccinist theory too. Dermatology has been under the siege of COVID-19. What does that mean? The pandemic interrupted regular medical assistance needed by patients. The diagnostic of new skin diseases was delayed. The programs of screening and prevention were interrupted. COVID-19 gradually derailed the treatment of dermatologic diseases, and the diagnosis of skin cancer in new patients was delayed, with the effect of reducing the success rate of effective and less effective treatments. Patients with severe skin diseases will amplify the negative impact of COVID-19, and chronic patients under various treatments had difficulty accessing those therapies. Many dermatologic hospitals were turned into COVID-19 support hospitals, like in Romania. And of course, many dermatologists were redirected there. Dermatologic emergencies were ignored by the authorities because they were not familiar with them and excluded them from the emergency list. This was the situation in the first months of lockdown in Romania. Skin diseases were postponed, and with some exceptions, and the patients were reluctant to consult a doctor because of the risk to catching COVID-19, and fake news made people skeptical about the existence of SARS-CoV-2 virus and efficacy of vaccine against it. Doctors become aware that skin could be involved in COVID-19 manifestations. The EADV published a mixture of images which quickly went viral, showing skin manifestations in COVID-19. Many other publications describe the mechanism of skin manifestations in COVID-19. Here one published by GAD in October 2020. It's a study on 760 cases with COVID disease, and morbilliform morphologies were dominant on this study. The most important three questions asked at this time were: can one administer biologics, immunomodulatory therapy, or cytostatic drugs? What kind of skin side effects produce COVID-19 medications? And the effect of COVID-19 vaccination on patients with skin diseases. And we are still waiting more details on these directions. The new normality means online information communication, telemedicine for triage and management of patients with chronic diseases. Doctors had access to medical documents from outside their location. Medications could be delivered at home. Automatic renewal of prescriptions, and reorganization of medical services according to new regulations. Teledermatology was seen as a life-saving instrument. Of course, there are pros and cons for its use. I don't want to enter in details. In my opinion, teledermatology will probably survive the pandemic, but it surely must be further improved and developed. All through the pandemic, we have respected all the rules imposed by authorities. New healthcare protocols, safety and prevention measures was introduced, like mandatory COVID-19 testing for surgery patients, where the contamination risk is higher for the medical team and for the patient, or mandatory testing for employees when returning from holiday. So I discovered 3 members of our team with positive disease without symptoms, or additional space and air cleaning and disinfection on the whole medical environment. To better understand how I help my business to survive, I will share with you the way my business is organized. At this moment, I'm running a private dermatology clinic in Bucharest, Romania, with 75 employees. We have no private insurance, health insurance, and the patients pay directly for medical services. No patients, no money. These are the 4 large medical departments organized in a working floor dedicated to both skin health and beauty. The most important department is the Dermatology department with a mouse unit inside and a sentinel lymph node surgery and a plastic reconstructive surgery. We have a small pharmacy with dermatologic profile and a cosmetic unit too. We have a community of 300 partners who direct cases towards us. We educate our patients through our Foundation for Skin Health, communicate to the public information on skin diseases, as well as educate our partners through e-learning platform. My business, with satellites and partnerships, tries to provide a complete medical performance for dermatologic patients. We perform screening, clinical and histological diagnostic, and we have medical and surgical solutions for our patients, even oncological treatment and the follow-up system integrated in our IT platform. We have access to genetic lab, an imagistic clinic, a nuclear medicine clinic, and a radiotherapy and immunologic therapy clinic. We can access medical file anywhere and anytime in a tumor board. And we can also use integrated software that collects and stores information to the patient floor. This is a structure of medical team with the physicians belonging to the clinic. You can see we are 16 dermatologists inside. Among them, I'd like to mention the 3 most surgeons, 1 pathologist with European accreditation, 1 oncology surgeon, and 1 wound healing surgeon, and 2 plastic surgeons. The impact of my medical practice has been huge. We were obliged to create new workflows and healthcare protocols. We are assigning additional resources to our budget, and we reduce the number of patients and staff having access inside the clinic at the same time. The sudden closure made us take quick measures for saving the business. The first thing was to maintain communication with our patients, and we made use of every communication channel through social media. We did reply to every email and answered by any phone call, and in short time we have built and activated our own platform of teledermatology. We have redirected our activity in online, and we have made available our telemedicine platform free to our partners because we understood that it is necessary to survive together as a professional body. The most difficult task was the management of oncologic patients, keeping in contact with those in need being vital for the clinic, but also for our patients. I will give you an example of a patient with melanoma operated for the sentinel lymph node. He had negative PCR test 24 hours before the surgery, but became positive after 4 or 5 days. All the surgical team were negative. So the whole post-op management was performed online. We offered him not only everyday advices how to cure the wound, but also emotional help. Another thing was that we was obliged to reorganize the clinic daily schedule. We have been open for emergencies 1 day a week, since there are emergencies in our field too, and telemedicine cannot replace face-to-face contact. We changed our protocols. We have established 3 main groups of activities, like emergencies comprising surgical procedures for acute suprainfected lesions, and for certain types of cancers like malignant melanoma, Merkel cell tumor, invasive SCC, and have also performed a few biopsies, thus delaying treatments, especially for BCC. By teledermatology, We have performed a triage of cases. We have monitored patients already in treatment and have diagnosed and treated diseases with a typical pattern like zona zoster, erythema multiforme, psoriasis, contact dermatitis, and so on. We have almost completely stopped aesthetic treatments and lasers or any other devices in the emergency time. We have set up medium and high-risk surgical procedures and have worked out ways to protect ourselves and our patients. And we have similar protocols for aesthetic procedures too. In the 2 months of lockdown, we realized how easy it was for a business to fail. We learned the importance of maintaining the professional networks. The time of lockdown was used for implementing educational programs for general public, for GPs, for dermatologist partners on our e-learning platform, and we organized many webinars. My mouse fellows were able to access slides in the histopathology lab every day. All this activity increased our competence, our expertise, visibility, and accessibility. The reopening of the clinic was performed gradually, initially with a reduced work schedule and teams. We immediately adapted to a new situation. One way in which we expanded the business was offering PCR tests to the public. We obtained permission to offer this after the start of the crisis, and we really were surprised by the number of patients who require this service, up to 100 per day in the holiday period in the summer. This kept our cash flow going and ensured. When reopening, we strengthened the prevention means. This meant high costs in the period of lower revenues. Like everywhere in the world, supply of sanitary materials was scarce and the price went up. But we have benefited from a minimal support from the state, mainly loans for salaries, taxes, and new equipment. So we invested this money in lab equipment, sterilizing new devices, and external room for PCR tests, and we developed IT platforms. By studying the operational indexes, we found by the end of the year that we had recovered and finished the year with the same value as 2019, without changing the prices and providing value-added services only. On superior level, you can see that the gray line, it's the profile of 2020 year. It was a little bit strong to maintain the business on the line. But as Mary Poppins once said, everything is possible, even the impossible. By the end of the year, we continued our development and invested in a new dermatologic surgical unit in the largest private oncologic hospital to be inaugurated in February 2021 in Bucharest. There, we added a new department of wound healing. How to remain successful after the crisis? I think being connected with your colleagues, with other clinics, understanding patients' needs in crisis time, optimizing the relation with patients, even resorting to online communication, improving patient safety in cutaneous procedures, standardize everything, working protocols, daily schedules, procedure setup, etc. Adapting to new situation and finding a new business niche. Using all resources from government or banks to help you navigate through the crisis and work with current technologies, but also look for future technology. Our specialty has been deeply affected by the pandemic, so I'm pleading for mandatory re-evaluation of dermatological diseases which could be placed in emergency diseases in order to justify our continued activity during the crisis time. We must focus more on procedural dermatology in ambulatory clinics. And of course, the legislative and deontological framework for teledermatology must be also defined. Questions for the future. This year we should answer more questions. What was the distribution of COVID-19 in dermatologic medical environment? Were the strategies to prevent SARS-CoV-2 transmission during dermatologic procedures enough? How many dermatologists were ill due to exposure at work? What was the price of stopping our specific activity? And what will be the impact on evolution of skin diseases after this difficult year? Our professional organization should lobby for importance of the dermatologist in health services and to provide support for the EU dermatologists to maintain their professional identity. All of this above will serve as arguments for our local authorities in our countries. So, in conclusion, I think that it's possible to survive and even remain successful after the crisis is over by staying focused and healthy. This is why both myself and my staff got vaccinated. Thank you for your attention and have an excellent day. And now I would like to invite Professor Leonardo Marini to say his point of view about this difficult period. Professor Marini.
Thank you. Thank you, Mihaela, and thank you for inviting me to this fantastic webinar. So I'm going to start with my presentation, which is how to run a successful dermatology private practice in pandemic situation. Mihaela already illustrated the overall situation from this very, very wide perspective. I'm going to go and present what we did in order to get a successful practice going. So I'm going to start with my presentation right now. So we were ambushed by the virus in the early stages of 2020. We were, catch unprepared, and we tried to react to our best. So our life changes dramatically. Our patient life changes dramatically, and a lot of fear and a lot of uncertainties were, widespread everywhere. So empty cities, distant connection with the computer, and all the world changed. This impacted the overall patients and population attitude towards life. So lack of knowledge, lack of health behaviors, we didn't know what to do, lack of mental health assessment and self-adjustment methods to COVID really created big pressure on all of us. And acting on the way we reacted to the environment and to the overall surroundings. So we started to have economic problems, as Mihaela said, change in sleep pattern and nutrition from patients, sleeping problem and concentrate, facing great changes in adaptability, a lack of physical and mental health knowledge because we were unprepared. We didn't know how much this pressure will create problems, mental problems to our patients. So anxiety, depression, and stress were quite widespread. So the news, death toll, lockdown, panic, crisis, isolation, all these new words came into reality, and they were invading the information in the media. And from the government, there was also stroke and from the virus and cut and unprepared. So there was a strict recommendation for social distancing and confinement, which of course created some an impact on the way patients reacted towards us. So the patients fear of being contaminated by the virus if they come to the clinics. So what was the best message? The best thing to do was reassuring patients with reassuring messages. This we did, and Mihaela already said, We needed to be present on the media. We need to answer all the questions virtually, and patient like this. So we were close to the patient with positive messages. We have adapted our practice and procedure to protect our patient and our staff from COVID-19. So stressing that patient safety is our primary concern. And we are taking all necessary precautions to ensure optimal safety and prevent contamination during permanence at the clinic. And we stress that these steps will be continue as long as the situation requires. So we changed the waiting room. So this is the original waiting room now. In our waiting room, maximum of 6 people can sit, and we sanitize everything. So the protocol is very strict, but with discretion. We need to be discreet, not invasive. So patient needed to familiarize with a new kind of doctors, like in science fiction movies. So doctors need to wear protection masks, protecting caps, 2 masks, and everything was, kind of a barrier from the natural communication system. But if you analyze the situation and you present the situation in a very comfortable and friendly way, patient accepts. So as Mihaela already stressed, clear communication is the key to reassuring patient during COVID-19 pandemic. So we needed to reassure patient with clear messages. So again, patient safety was and is our priority, to prevent infection, to protect the patient, and to support, of course, the environment from being affected by the virus. Huge efforts have been made to secure medical offices and optimize examination condition in order to avoid contamination. And this came with a lot of cost on our shoulders. But there was an investment and a way of learning how to optimize our work as well. So protect ourselves and our profession is not enough. We needed, again, to communicate clearly and effectively to our patient, because they need to understand and being fully aware that all we do is for their safety and when they come to visit us. So our personnel strictly adhere to safety protocols and hygienic measures. Appointments are given in order to avoid queues. Waiting rooms have been modified, as I said. Our examination techniques have been modified according to meet with the new requirements. And if patient requires surgery, we stress that our surgeons and anesthesiologists are being specifically trained to face this pandemic in a very well organized way. Telemedicine consultation become quite popular with some limitation, but again, it increased the vicinity with patient. Patient needed to understand that we were there when they needed to for us to be. So we always adopted preliminary triage by secretary on the phone in case of patient coming on for regular consultation. Then, of course, we provide protective masks, compulsory, hand disinfection, disposable plastic bags to temporarily store personal items to be discarded at leaving the clinic, shoe covers compulsory, written personal safety declaration, because before getting into the medical world, because of the medical legal issue is waiting for us in case we are failing this kind of protocols. If patients can show or can assess that in case of contamination, in case of COVID infection, the patient got COVID infection in our clinic, we need to shut the clinic down. So it is very important to stick to very, very strict protocols. So temperature registration by nurse, and we keep all the documents for later in case we need it. Personal safety declarations are collected and finally checked by medical director and myself at the end of working day. No more than 2 persons allowed in any exam rooms. Patient clothes, shoes, and personal items are stored in sanitized lockers, so we don't contaminate the full environment. disposable patient gowns, discarded at the end of the visit procedure, and the end of medical visit procedure, patient wait in medical corridor to be called by secretary once all the medical papers and bills are ready, in order for them not to spend too much time at the checkout. And patient go to checkout located at safety distance from the check-in and leave the clinic from a secondary exit in order not to have a contaminated, path. Was it that difficult for us to implement all this? I won't say that, because in laser dermatology, we already implement many safety precautions that could be, interpreted also and implemented in COVID times. The common risk in laser dermatology are the eye, so we regularly wear protective goggles, and of course the skin, so we need to wash the hands, we need to protect the skin at the end of the procedure, and of course teeth, which is the lights is not the case with the COVID, but in case we operate on the mucosa, we have the patient do a mouthwash with hydrogen peroxide, 3%, 1 minute, like the dentists use today. So respiratory system, we in laser dermatology, we know that we are risky, and so we wear protective masks. Gases coming from the laser units, and not only that. So, and of course, again, electrical risk is not applicable, but we just list this risk because we are aware that every time you enter a laser room and you operate a laser, you need to be very alert and you need to have protocols. And this is why, for us, it was quite easy to enter this new environment. Okay, so when you clean the skin of the patient before laser, and now we clean the skin of the patient more intensely when we operate, we need, and we use the laser after, we need to know that if you use a alcohol-based detergent, you need to wait until the complete evaporation is there, because otherwise you can have an ignition as a risk. So, what kind of implementation of the safety measure can be implemented? Safety is at the center. We have active protocols and we have passive protocols, which is, of course, and I'm talking always about laser. So you can see how easy it was for us to enter this COVID time in terms of organization. So we have laser room access, which is restricted. And of course, we have readable restricted access signs, so patients know what to do, as they know today in COVID time what to do. So protect the eyewear, as I said before. We need it with laser. We have special filtering lens. With COVID, we wear all the time protecting goggles because we know that contamination can happen in the ophthalmic mucosa, and you can get COVID by that. Protecting mask, we already use a filter mask, like the highly filtering mask, to create this kind of barrier to what? To the virus and the plume particles contained in the virus particle contained in laser plume. So we already use the high efficiency, particularly arrestor N95 respiratory mask, where we operating the skin. So nothing news for us. Smoke, we used to capture smoke as close as possible to the vaporization site, 2-3 millimeter, in order to aspirate all the plume and prevent the environment to be contaminated. We do this every day with laser, so we didn't interrupt the use of laser. So infection at that time was mostly HPV. Of course, we want to prevent the chemical and mutagenic, of course, hazards, because as you know, the smoke generated by 60 seconds from 1 gram of skin tissue is equivalent to that of 3 cigarettes in case you use the CO2 laser, or 6 cigarettes if you use electrocautery. So you need to aspirate to get rid of the plume. So we wanted to be certified because, again, for medical legal purposes, we needed to implement everything, but not by ourselves. We wanted to have a specific official certification by an external company that said that all we're doing, all we are implementing is under the rule. So we change, of course, on top of the laser warning signs, we start some self-explanatory friendly pictograms to inform, explain, and remind patient what to do, but in a very, very gentle way, not aggressive way. So the take-home message is how to keep and run a successful clinic in COVID times. Stay positive. So you need to be positive and transfer a positive message to patients. So all safety measures should be thought as temporary, always giving hope for a natural recovery, which will happen. All of us are, of course, vaccinated and immunized, and so this is also a plus for patients coming to the clinic. Positive messages should be reinforced, and patients should leave the clinic with the positive, reassuring message to spread around, because the word of mouth will do the rest. And because more patients that were reluctant to come for consultation, they will receive the message and will contact you for procedures. Soon the economy will recover. So the pandemic, which is striking very badly on the economy, it will end. And we have according to the forecast, a rapid rebound in certain countries and a deep and stabilization rebound in other countries. But finally, we will come back as we were and even stronger. Thank you for your kind attention. And now, after listening to the two presentations, we are ready to entertain questions. Of course, we receive many questions and we try to do our best to answer the question as it comes. Okay, thank you.
And I will advise our listeners, if you are watching on any of your platforms, you can go into your comments section and write your question there and we will receive it. So anywhere you are, write in the comments section and we will get your questions.
If you don't have any question, I have a question for Mihaela. I really appreciated your presentation, Mihaela, because it gave us an overview of what COVID did on us. And my question is, how long did it take for you to react and be ready to face this kind of situation? When you were listening to the pandemic, the pandemic issue was released by the World Health Organization. And then how much time did you take to react and implement all you did in order to have your practice ready?
Okay. I was really surprised in the first months of lockdown. I asked myself how it's possible to lose your business and how it's possible not to work for your patients. My clinic, it's a big clinic, of course, in the center of our capital in Bucharest. So I'm very visible. I was obliged to respect all the rules. When they stopped the activity, I was obliged to stop. And after few, I think 2-3 weeks, I decided that it's necessary to change something. I started this, of course, this real contact with our patients. We answer to all phones, all emails, but I realized soon that it's very important to keep the team together and to give them opportunity to work something. So we started our educational programs for GPs, for our partners, and this improved our public images. Immediately after the lockdown stopped, we were able to take profit from this activity, this education activity. And we learned step by step what we have to do. At the beginning, I was really scared. about pandemic, because I didn't have any kind of patient with this disease. I'd never seen. And I asked myself how I can protect me and my team and my family too. And after that, we were obliged to start some activity. It was 1 day emergency per week. It was in the first month of lockdown. And after that, I discovered that not emergencies recognized by our specialty or our staff, it's not recognized by authorities. It was one problem. But for our patients, even a small problem like a growing nail or some infection on the skin or some contact dermatitis, it's a real problem and they need real support. So we started to work step by step, first of all online, and after that directly with patients who needs help.
So, Mihaela, sorry to interrupt you. So, how long did it take to implement all this? 1 month, 2 months?
2 months.
2 months. So, from the beginning, because every one of us got kind of took by surprise first. So this was a kind of receiving a big shot, and so you fade off, so you don't understand where you are. So then you started to react. So, and this reaction, in order to react, you need to think first, and then you need to elaborate a strategy. And then when you elaborate a strategy, you need to implement the strategy. So in order to do this, it took 2 months to your clinic to be fully operational in COVID time.
Yes.
Good. So I think that we share the same because the same kind of time schedule happened to me. At the beginning, information was scarce. We didn't know much. The government was, let's say, kind of skeptical what to do. Do we need to scare the population? Do we need to be optimized? They need to pump the population. We didn't know what to do. So we were in the limbo. But our business cannot be in a limbo for much long because we have, of course, personnel and staff to pay. We are in private practice, so like an industry, so we can have some reserves. But when reserves are over, so we need to close. So I think that is very important as an entrepreneur to understand the difficulties. And when the government is still striking about strategy, what to do, so it is our main responsibility to engage our brain. We are doctors. We know what a pandemic could be, and we can implement something by ourselves. Keeping, of course, always in mind that we need to be on the safe side for us, for the family, for the population, and for patients. We did the same. We opened the clinic 1 or 2 days per week just for emergencies. People don't know what an emergency is. Sometimes they come for not emergency, but we were able to keep the clinic open. And this helped these people coming to the clinic, seeing that we were already adapted to the COVID time, and we were positive and we were helpful to them. So they left the clinic not only cured because of their kind of emergency, dermatology emergency, but also cured mentally because they say something is working positive for us. So this was a positive message to them and the family, and this message is spread. As a matter of fact, we receive more phone calls week after week after week when we open for emergencies. Now we work full time, like before. And cosmetic procedure, non-cosmetic procedure, oncologic procedure, people are willing to get something for themselves. They want not only to be cured because they have a problem, but they want to be cured because the mental instability, the stress, make them, kind of weak, and they want to do something for themselves.
Okay.
This is why yes.
I'd like to ask you now, Leonardo, did you have some helps for your government, some financial helps like this, some loans, or something special for this period? Nothing in Italy?
We of course, during the lockdown time, we couldn't afford to have a full-time our staff working. So the government contributed for the paycheck. Okay. This was the only contribution that we received from the government. No other loans, nothing. But of course, we were kind of hyper reactive, because we know that we needed to be reactive and positive. And I must say that we didn't lose much money. At the beginning, we were skeptical, we were worried, but now we are not worried anymore. So the message for all the other doctors is that, of course, we are in the middle of the second wave of the pandemic, and probably we're going to have the third wave. Like most of the pandemic, nothing is new, because this is happening with the flu many years ago. And today we need to take advantage of technology, and we are now, thanks to EADV, and not only, this is the way we still are connected with the world, thanks to technology. Imagine many years ago, this was not possible. So we can educate colleagues, we can talk to colleagues, we can really educate patients. So it's a different kind of environment. Vaccination, of course, it's a kind of mirage. We hope to have it by the end of the year. We know that even companies producing virus that they produce, but they don't know. So it's a big, question mark. So, but I'm still positive by the end of the year, 2021, probably this kind of virus will be defeated, and then we're going to be able to be back to our life as we used to be before. So any other question from the audience?
We actually have two questions for our speakers right now. Beyond the wonderful comments and the very positive reinforcement that the people have been posting, we have a question for both of you from a member. Whether you have had cases where the staff became infected after contact with an infected patient of COVID.
I will answer first. We hadn't any kind of COVID-19 on the medical staff, but we had 3 or 4 cases on the receptionist desk. All these cases were infected outside from the clinic, and we learned from this that it's important after they came from the holiday to check, before entering the clinic, to check if they are negative or positive for COVID-19. So no non-medical staff, but only receptionists.
No cases in my clinic, thanks God. So we were very strict with the protocols, and no COVID cases. So this was a blessing from above, but we are safe.
Okay.
That's excellent. Another question from a member. Could the speakers comment on how private practitioners may offset the direct and indirect costs of keeping a practice open and running during the COVID pandemic?
Well, yes. You want to answer, Mihaela, please?
It's a difficult question for me. Okay.
So how can we do this? It is not easy. In private practice, we have risks, and we need to face this risk in a very, let's say, relaxed way. Don't panic. So direct, indirect costs are there, and they will be always there. We need to try to optimize with the standardization all the costs. But we did already before the COVID time. So we want to get even better standardization, try to eliminate what was the unnecessary investment. So the unnecessary investment we postponed, and we were able to select what we consider essential for survival.
Mhm.
So we had a plan, and the plan was modified about the investments before COVID time, and then we modified the way we were spending the money in order to get a better control of what was the, let's say, potential of our business. Because otherwise, if you don't pay attention to this kind of modified strategy and you continue to go as you did before, then of course, sooner or later, you're going to be in trouble. So the cost of the running costs are always the same. And as a matter of fact, they are a little bit higher because we needed to implement a lot of safety procedure, protecting masks, disposables. They are much, much more, used today. But again, you can compensate with an optimization with the other expenses.
Now I understand better. Sorry. It's the similar situation for my clinic. At the beginning, we stopped all investments. We invested all the money for new medical consumables, which were with higher prices. We were obliged to buy a new sterilization equipment for nebulization the space, and we were obliged to change our mind and to renounce to some projects. But finally, in the last period of the year, we understood that it's necessary to be more courageous. So we decided to invest in the new surgical department in the new hospitals. And in my opinion, it's very important to be courageous and to fight for your business. And development, it's a solution. For me, to find a new niche was I was saved by finding this new niche. It was PCR in the summer period, but now it's not in the fashion to. It's new style of testing, like rapid testing. So PCR is not so important. But we will develop a new niche, new professional niche like wound healing department. So only to keep to be involved in this. Practical dermatology, to keep our patients close. And I understood that it's very important to have a new a new business niche, and we will start an e-commerce niche online for our pharmacy. We have a small pharmacy, and we can deliver our medicines to our patients directly at home. And so I hope to resist in the future.
Well, definitely certain kind of strategy will survive after COVID time, and we will take advantage of this kind of, let's say, innovation. But I still hope that we will take these strategies with a eyedropper, not fake, follow this rule forever. Because otherwise, we're going to be so deeply affected by this kind of behavior that our life will never be back. So again, if you have a computer, you need to use the computer, not to be a slave of a computer. So I think that, again, this COVID time was an opportunity to understand the importance of reacting with courage, as you said, optimizing our resources and optimizing relationship with our patients and our colleagues, because the anxiety level makes people aggressive, and
Yes.
not only patients, also Also, I'm sorry for the announcements. Also for the colleagues. So we need to be calm and quiet, to have a friendly kind of attitude in order to calm down this kind of reactivity. I personally noted that many patients come to the clinic trying to, let's say, get off their psychological problems on us for nothing. So we are becoming not only dermatologists, but also some, psychologists. So it is a kind of difficult task. So we should charge double. But anyway, we still keep the price for as it was before. But just kidding. So again, positive messages. Positive messages is the key. Yes. Yeah. This is a take-home message for everybody. Optimize resources and be positive.
That is fantastic information, and I think it was so thorough, we did not have so many questions. You've covered pretty much everything. So with that, I would like to thank all of our audience on behalf of the EADV School. We thank you all for joining us, and a special thank you to Dr. Leventer and Professor Marini for sharing their knowledge and experience in managing healthcare services, in particular their private practices during the COVID-19 pandemic. Now, for EADV members, you can watch this webcast on demand at eadvelearning.org. And we'll see you again in 2 weeks on the 10th of February at 2 p.m. with the webcast, Merkel Cell Carcinoma, Clinical Practice and Update. Again, thank you all, and a special thank you to our presenters today.
Thank you. Thank you.
Ciao, bye-bye. Thank you, Chris.